Hi, my name is Dr. Jenny Wakely. I'm a GP working for the NHS and I also specialise in dermatology. I also run a company called The Beauty Doctor, specialising in cosmetic treatments and dermatological advice. So I'm here to talk to you today about how to get rid of dark underarms. Mainly this is a problem of darker skins, Mediterranean, Asian, Afro-Caribbean type skin. There's two main causes. One is something called acanthosis nigricans, and there's lots of different subtypes, but the most common is hereditary. So you're just born with it, I'm afraid. And then the second one is post-inflammatory. So if you're, after shaving, if there's a bit of irritation, if you're irritated to the deodorants that you use, it will often go darker after the initial irritation settles. So you need to obviously avoid whatever is causing the irritation. If that means stopping shaving for a while, then do so. Or if you can wax, that would be better. And then it will actually gradually fade. If it's hereditary, then you might need to use like a gentle peel, a glycolic acid type of peel, combined with something called a blending bleaching cream with retin-A and kojic acid in it to prevent re-hyperpigmentation of the skin, and that will gradually, with time, fade the skin away. However, there are some other forms of acanthosis nigricans, mainly in overweight people who have raised levels of insulin, and also people with hormonal imbalances such as polycystic ovaries. So it will help actually to treat the underlying cause of high levels of insulin or the polycystic ovaries, but you may not completely get rid of the dark underarms, so you do need to see a GP if you think either of those two apply. In addition, if you're on medication such as insulin injections or other medication, that can also make the armpits go darker. And I'm afraid you can use peels or various bleaching creams with retin-A, kojic acid, hydroquinone. They work very well to reduce the melanin pigment cells in the skin. You can get some irritation with hydroquinone and retin-A, but because they're not exposed so much to the sun, the irritation is less so. Using the retin-A, vitamin A based creams, you do need to not have it if you're pregnant or planning a pregnancy. But kojic acid and hydroquinone are fairly safe to use. The hydroquinone you need to use maximum for a period of 2 to 3 months and have about a month or so break in between. The other cause of dark underarms is something called erythrasma, which is actually a bacterial and or fungal infection of the armpits and sometimes the groin area and also between the toes. In Caucasians, actually it's not a dark appearance, it's a pinkish appearance, but in darker skinned people it can be sort of a brownish appearance, and it's often scaly and may not have any symptoms with it. But it will sort of spread relatively quickly, so you'll be able to tell the difference between that and the other conditions I mentioned above. And if you go to your GP, they'll prescribe you an antibiotic or antifungal cream to put underneath the arms. Very rarely you do need an antibiotic tablet. So I hope this has been a bit useful in how to get rid of your dark underarms, and thank you for listening.